Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Howard, how are you doing?
Well, I'm having a little trouble smoothing this wax flange.
Let me see it a minute. Is this the instrument you're using?
Uh-huh.
This is the wrong instrument. This is a Kingsley scraper. Actually, what you should be using is a number 7 spatula. Do you have one of those?
Judy, can I borrow your number 7 wax spatula?
Sure.
Where's your spatula?
I left it at home.
See, this instrument works lots better. Actually, you can smooth that flange out quite nicely. But really, to finish the job, you should use your alcohol torch. So let's use your torch, and where's your torch?
I left it in my locker.
Well, maybe you can borrow one.
Judy, can I borrow your torch?
You know, Howard, do you understand the definition of organization?
Dr. Horde, would you check this impression tray?
Yeah. That looks really nice, Nick. Looks real nice. Got nice extension here in the lateral throat form and nice buccal shelf area here.
Dr.
Channel
Horde,
freedom.
line 5, please. Dr. Horde, line 5.
Listen, I'll check this a little later for you and give you a check off on it, okay? I've got to answer my page.
Okay.
How you doing, Nick?
All right, I just finished an impression tray.
Okay. Mind if I look at it a minute?
No, go ahead.
Okay. I feel it's a little long in this area on both sides.
Oh.
Just a little long. I think it'll work better if you do that.
Well, Dr. Horde just said it was all right.
Well, it's a difference between instructors, but see what you can do, okay?
Oh, okay.
How's it going today, Nick?
Uh,
I see you got the tray.
yeah.
Nick, these flanges are way, way too short. You know, we can't tolerate a tray that's, that's way too short. We just can't tolerate something that's that poor.
Dr. Moore, I'd like a check on this, please.
Sure.
Hi, how are you today?
Fine, thank
Good.
you.
Big for me. Now, this is your final carving, right?
Right.
Okay. I want you to hold the mirror so that you can see, and I want to show you a couple things about it. You see here on the occlusal margin how your amalgam is all rough? Well, this is because there's excess amalgam which you haven't carved away yet. And
I see it, but I don't think there's excess.
well, okay, remember your cavity preparation, and when you prepare the occlusal cavo-surface margin, it's a fairly smooth outline form. So we'd expect the restoration to conform to the same smooth outline form if you've carved the amalgam back to your margins. But because the amalgam is rough around the occlusal contours, that means that there's excess amalgam spilling over the occlusal cavo-surface margin.
Well, I understand what you're saying. It really looks good enough to me. You think I should do it again, or do?
Well, it's not a matter of doing it again. It's a matter that you have to cut or carve the amalgam back to the cavo-surface margin in order to be an acceptable restoration. So, as it stands now, it's not an acceptable restoration until it's carved back to those margins.
Okay, well, I'll carve that.
Okay, fine.
A little of it. Dr. Moore, could you check this once again?
Sure, I'd be glad to. Now back again. Okay, this is really coming along fine. You've carved away most of the excess. There are still a couple of places, especially in the buccal and lingual developmental grooves, where there's some excess amalgam.
You still think there's some excess?
Yes. Look right in the mirror and hold the mirror so you can see it. And there's excess right out here into the buccal and lingual developmental groove. See that?
Well,
Remember, amalgam as a restorative material has very poor edge strength. And if you don't carve these areas of excess away, they fracture away under chewing forces, and it leaves a very rough enamel amalgam margin. This collects plaque and is an area that we see a lot of recurrent decay. And this is the most convenient time to carve that margin in a very smooth way.
so I should work on it some more.
Well, just carve those areas away and I think you'll have it.
Excess my foot. He's so damn picky.
Hey, Tom, how's it going?
Oh, pretty well, I guess.
Yeah, hey, it's a great party, isn't it? Lots of beer and good music.
Yeah, it's really nice, but I have a lot of things to do.
What's with the coat? Where you going?
Well, I haven't finished that dentures assignment. There's a lot of other homework I have to do yet. I really have to go.
Oh, hey, don't worry about it. I haven't done it yet, and I'm not worried. It's only a 10th of our grade.
Well, I really have to go.
Hi, Tom. How's it going?
Oh, pretty good. I'm just starting on my second case here.
Good. Hi, Nick. How you doing?
Just fine, Dr. Fowler, just fine. I was wondering about the wax occlusal plate, though.
Well, did you check on that in the manual? Have you read the manual here? Have you read the manual? Well, it's right here on page 11. It goes through this. Here it is. Yeah, page 11 goes right through this. You know, step by step as to how you should prepare that wax. Have you looked at the models in the display case? You know, they also show the wax occlusal rim.
Yeah?
You know, Nick, we spent a lot of time this summer making the videotapes down at the Kite Center, and they go through this too. And, you know, you should be a little bit more prepared, and I'd suggest you go down and view those tapes because it goes through this step by step, and I think it'd help you a great deal. Because if you'd done that, you'd obviously see that that wax occlusal plane's too low.
Okay.
Be a little better prepared next time, Nick.
Okay, Miss Claire. I'll just get an instructor and we'll check this right out. Dr. Moore, could you check this prep?
Oh yeah, sure. I want to see that preparation. But listen, I've got a couple of students ahead of you, and I'll be right back. Just take me a second.
Okay.
He's seen 4 students who asked for a check after I did. He always puts me off. Or he's talking with another student. Or he's with a bunch of instructors and I can't get his attention. Or he goes out. Where does he go? To get coffee? Down the hall. He's so distracted. I can't go ahead without his check. This is ridiculous. I'm sick of waiting.
Well, that didn't take very long. Thanks for waiting. Say, could you just move back a little bit here? I want to take a quick look at this. Yeah, that's fine. Just go right ahead.
Morning, Nick. How's it going?
I'm having a little trouble adapting this base plate.
Well, let me show you how to do it. First thing to do is to use this torch. And
Would you explain to me what you're doing?
well, see, just do it like that.
I can't see what.
So you got to burnish that in there, and that kind of push that in there. Kind of nice.
I don't quite understand.
There, see, now that's pretty good. See, that does it. Go ahead, do it just like that. That'll take care of it.
Pretty simple.
Yeah.
Dr. Ling, while you're here, could you check my base plate?
That cast is too thick.
Yeah, but what about the base plate?
And, you shouldn't really have these lines on here. I'd scrape those lines off and smooth that out quite a bit. And then that'll take care of it.
But is the base plate all right?
Cal, this is a final check on an inlay class 2, 30-25.
That's right, Doctor. Real happy with that one. That's one of my better ones, I think.
Cal, did I give you the cement check on this case?
No, you didn't.
Well, Cal, in all candor, I like the finish. I like the anatomy.
Thank you. I did too.
But did you really take a good close look at the interproximal on that distal?
Yes, sir. Yes.
Did you check that contact?
Well, sure I did. It was, as a matter of fact, it was perfect on the die.
Perfect, like daylight flowing through from east to west. Did you really take a look at that cervical?
Well, of course I did.
Cement
I
is
wouldn't put it in there if I
flowing
didn't.
out of that cervical, Cal. This is strictly in the island of gold in a sea of cement category.
I never heard of a category like that.
It's the redo category. Redo. Emphatically redo. No question about it. It's the end of the line.
Oh, jeez, I think he should get lost in his sea of cement.
What's going to happen now?
We're going to have to do the damn thing over again.
Listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.